Thank you so much. I am delighted to be here. And what I have to say about the work of Less Cancer is just, wow. So I want to talk a little bit about, I'm actually an internist, preventive medicine, public health specialist by training, and I spent most of my career in public health practice. Right now, I'm an associate dean for public health at the Larner College of Medicine at the University of Vermont. And I do a lot of work with our Vermont Cancer Center, where I am an associate member. And I'm also part of the steering committee of our Vermonters Taking Action Against Cancer, which is a statewide coalition. Coalitions are really important. And they have the responsibility to implement our state cancer plan, which is all about reducing disparities, prevention, screening and early detection, treatment, and survivorship. So they have a tough job, and they're doing important work. I also just want to mention that I'm absolutely delighted to see so many students here today, and I have some special messages for you. So I just want to talk a little bit about access and health equity. And Robert Wood Johnson Foundation defines health equity that everyone has a fair and just opportunity to be as healthy as possible. Now, this is a tall order, and practically, I think what it means is we have to identify those health disparities and understand them, figure out what the barriers are, whether we're talking about screening or access to care or education, and figure out what we can do about them. In Vermont and nationally, certain vulnerable populations consistently face barriers to good health, and these can include, but are not limited to, low-income families, racial and ethnic minorities, people with limited access to health services, those with less than a high school education, members of the LGBTQ community, people with disabilities, and people in some rural communities. So in my work, I've seen as barriers language, health literacy, transportation, income, health insurance, housing, food security, access to health providers, and the weather. And that's Vermont. So, what can we do? And I'd like to just tell you a little bit about the work that I do in Vermont communities, what our data can tell them, how do we think about this, and how can we use all the information that we have at hand, and it's readily accessible, to take action. And it's all about the action. So, National Cancer Institute, CDC, Robert Wood Johnson Foundation, other research studies tell us that where we live is really important. Our health is determined by our zip code. So, and in public health, how do we think about that? Well, we use a lot of data, and data is important for a lot of reasons. It helps us shine a light on a serious public health issue. It helps us set our priorities. It helps us have something to start a conversation in a community setting. And that data is readily available through the CDC, local health departments. There is a countyhealthrankings.org website that was done by Robert Wood Johnson Foundation, University of Wisconsin. Then in every county in the United States, you can see some of the leading health status indicators. And I think these are really important. And that data is a starting point for a better health. So I want to tell you a story, and this is for our students and some of the things that we do there. For about 15 years, I developed and direct a course that is a required course for our second-year medical students called Public Health Projects. It's all in the name. And that's exactly what our students do. They go out in the community in the fall, and they do projects with community partners. Our students ask, when I came to UVM full-time, they asked for a way to make a difference. So we created this course and put it as a required course so they would actually get out in the community. And what we do is each year I invite proposals from a long, long list of community not-for-profit organizations to submit us project ideas, health issues. Every year we do 17 projects in the fall. The entire class is involved, and the students have done more than 225 projects so far. One of the projects this year, the director of the Winooski, Vermont Food Shelf asked us for help. She said that she thought that food insecurity was just the tip of the iceberg, that the people she was seeing had all kinds of other health and social issues. So could we help? Well, Winooski, Vermont is pretty tiny. It's 1.4 square miles. There's just more than 7,200 people living there. But the poverty rate is 26%, which is more than double the rate in the 2 towns next door and more than twice as high as the poverty rate for the entire state of Vermont. So what we did was I went with a group of medical students and we interviewed people there over a 2-month period in the fall, and they did most of the interviewing. I went with them and asked all kinds of questions about people's health and barriers to good health. So here's what they found after interviewing people. They found that 38% were disabled, 20% had not graduated from high school, more than 50% had 2 or more chronic health conditions, and that can include some mental health conditions. And although nearly 80% had seen a healthcare professional in the past year, almost 60% smoked cigarettes. Aha. So what we found from these conversations can help determine what we can do next. What we can do is we can link the people who go to that food shelf to smoking cessation efforts. Those are by phone, online, in person, with free nicotine replacement all throughout the state of Vermont. We can talk with their health professionals who see them to reinforce the importance of their advice to quit smoking. So I just want you to think about the opportunities for people, seeing people who go to a food shelf every 2 weeks, that single opportunity, every 2 weeks, to be there, to be ready, when they are ready to make a quit attempt. Think about, over time, something as simple as that, in one food shelf, in one small community, could lead to less smoking and ultimately less cancer. I had one other quick example for my projects this year. The student projects this year were just, I see this every year, but our student projects were just amazing. And we had some advocacy projects. And one of our groups worked on policy. And policy not only is critical and important for leverage in terms of health benefits for many, many people, it's also the most controversial. So it's very, very challenging. They work with the American Lung Association of Vermont to talk to our legislators. And our legislators in Vermont they have their constituents call them from all over the state. So they really have great insights as to some of the barriers to good health in our population. And so we were going to work on tobacco. The Lung Association wanted to know how our legislators felt about Tobacco 21. So we're trying to get a statewide law that there have been 6 other states to do that, some local areas. Really, really important because about 95% of addicted adult smokers began before they were that age. And there's a very important Institute of Medicine report that showed that that would have immediate health benefits and reduce the number of young smokers, which we all know is critical. So what our students found, that our Vermont lawmakers overwhelmingly agreed, almost 90%, that we needed to do something about smoking young people in our state, but only about 60% felt that this policy was the way to do it. And they were worried about the economic impact on small stores throughout the state and also the tensions between individual rights and public health, and something that is a common tension in any policy initiatives. But this debate is going on right now as we speak, and one of the good things that has just very recently happened last week is that our legislature, our House of Representatives, passed a tax on e-cigarettes, which is another very important issue for Vermont and nationwide. So I've used 2 tobacco-related examples in terms today, but the same principles apply for screening, early detection, public education, and access to care. And my message is a simple one, that sometimes that we can, by taking on the biggest health problems can be taken on by starting in the towns where we live. And we can use publicly available data to start conversations, develop priorities, and take actions. And think about that as a nation, if we might start community by community, county by county, state by state, and then as a nation, ultimately, have less cancer. Thank you.
Thank you, Dr. Carney. I think we're going to probably have a question. But let's just see. Does anybody have a question for Dr. Carney? Anybody in here want to? Go ahead, Mindy.
I come to you from New Hampshire, where we have some of the highest rates of opioid overdose in the country. And it's somewhat connected sometimes to some people using for treatment for chronic disease like cancer. And I wondered if you had looked at that in Vermont, and if you had a similar issue in Vermont, and maybe in this study group in Winooski, had you seen higher rates of opioid overdose?
In that particular town, I can't really tell you. Yes, opioid addiction and our efforts in Vermont is a top priority, as it is in almost every other state in America right now. And the things we're doing are, first of all, working on the stigma aspect, because this is a health condition and there's something we can do about it. We developed a hub and spoke model for treatment and working very hard with physicians and other health professionals around the state to try and get people into treatment. And we also did things in the legislature, passed a law that directed the health department to have regulations around opioid prescribing, and there's been a lot of education, public education. So those are just some of the things, but yes, absolutely, it's a top priority.
Thank you. Okay, you mean to stand up?
Oh, Dr. Carney, my name is Michael Swanberg. I'm a clinical instructor at the University of Virginia. Thank you for the work that you do. I'm so excited that you're working with 17 different agencies in the community. One of the things that my university is very concerned about is memorandums of understanding with those agencies. And I can't even send a group of Thursday students to an agency on Tuesday because we're contracted to go there on Thursday. And I was wondering what sorts of legal liabilities and what sorts of memorandums of understanding you have with those agencies.
None.
Oh, okay.
None. Absolutely none. I work with the United Way of Northwest Vermont, and we together send a letter out to hundreds of not-for-profit agencies. They voluntarily come forward. They work in partnerships. They're partners throughout the entire project. I've never even had a question about liability. They come back year after year. And the reason that they do is because it's all about them, and we're helping them with what they need. It's not just what we're interested in. So I have had absolutely no problem doing it in that way, and with a long list of community partners.